6-week ACL lateral suture. And so what we're going to do is just do some passive range of motion, some massage. And generally what you would do is you can heat one of these packs in the microwave, get it warm, and prior to doing any of the exercise, put the warm compress over the upper part of his knee. That way you're including the knee itself and then plus the muscles up here, the biceps muscles up top. And so you would probably do some heat on that for like 5 minutes. And then we'll start with the exercises. And the first thing I would do is probably just start with some massage. And we'll just start just going across this muscle. And you can feel that this muscle group is fairly tight because he's been keeping it tucked up, his leg tucked up, and because of that, this muscle isn't getting much stretch. So massage it all the way up to the pelvis here. You can feel it all the way up top to top. And then just go back and forth, just gently rubbing across it. It runs like this, and so we're going 90 degrees to that. Just do a perpendicular massage all the way up and down. And he's already relaxing. I can feel it relaxing quite a bit. One of the big things with Milo is he didn't have so much of a problem with flexion. He can flex his knee really well, but his extension seems to bother him, and it's probably a lot in part due to this muscle. So we'll just kind of work on this. And what I would do at home is I would probably try to do this massage 2 or 3 times a day, just because I think it'll help loosen up the muscles a little bit and make him just a little bit easier on his walks. Okay, then the next thing we're going to do is move just like some passive range of motion. So in the same area we've been massaging, want to support that with your left hand. And then with your right hand, grab just below the knee. And we're just going to gently take his knee all the way up. And then all the way down and kind of hold it in extension. The other day when we did this, he really protested. And today he's not doing nearly as bad. And hold it. And we'll flex it back up. And then we'll extend it back down. Just hold it in extension for a little while. He's doing much better with this today. Much better. We'll do about 20 repetitions of this. I'll do a few where I'm just going back and forth, and then I'll hold it on like every third one. And hold it to like a count of 10 or until he seems uncomfortable with it. Okay, then we'll go some flexing. And you may feel like a little rubbing in here. It's just the suture. It's just because he's just been not using it much. And so that suture just kind of needs to find itself a nice home. So it's not rubbing so much on some of the soft tissue. And it's just because of his disuse. But the knee joint itself feels pretty good. And we'll hold an extension again. Good boy. He's really good for this. And then sometimes when you've got him in extension, you can also do a little bit of tug. Like just see I'm gently kind of shaking the leg, but I'm also just pulling down on it. Just kind of just getting those muscles to kind of extend out a little bit more. And there we go, let it relax. And he's tolerating this so much better than he did just 2 days ago. 2 days ago, he would not even let us hold an extension longer than like 2 or 3 seconds. Okay, and I think that's good. All right, now we're going to move. Oh, and after this, and then also after your other exercises, you want to put ice on it for 10 to 15 minutes afterwards. Always after all exercise, whether it's a lot of walking or whatever it is, come back and ice them. The heat, I would only necessarily do that when you're going to do your massage. I don't think you need to like put heat on it before you take him for a walk or something like that. I think it's more when you're doing the localized treatment of it, then I would heat it first just because it will relax the muscles quite a bit. And then always after all exercise, just give him a nice ice compress. And the same way, I would ice compress right across this muscle group and right across the knee. So just get these upper muscles and then right across the stifle, the knee joint itself. Okay?